came to Guatemala last year and loved it, and so all of us wanted to do some kind of nursing project and experience global health in the context of a Spanish-speaking country. So I convinced them to come, and so we planned all semester and got really excited, and here we are, and we're volunteering in Guatemala, and we love it.
We decided to become volunteers, or at least I decided, because I'm in nursing school and we are in a class right now to kind of experience global health. Well, I chose to come to Guatemala or a place in Central America because I know a little bit of Spanish, and it's really useful in healthcare. Also, it's just really beautiful, and I was excited to kind of experience the culture. I'm very interested in it.
I agree. I definitely chose Guatemala because of the Spanish language, because one of my goals is to be fluent so that we can be bilingual nurses.
We are working in El Puesto de Salud in Santa Lucia, and the puesto is basically a public health post. The patients have to arrive before 8, and then we take their blood pressure and weight, and then the doctor sees them, and then we give them medication. We specifically help out with blood pressure and weights, and we occasionally get to do injections because we learned it in nursing school before this, and we help out with the pharmacy. And the puesto itself aims to educate the community about healthcare.
And it really is kind of a health education place. And another aspect of preventative medicine is childhood vaccines, so we definitely get to partake in that a lot. We are those evil people who give little babies vaccines, but it's been a really cool experience interacting with the nurses and the doctor and just kind of interdisciplinary care and taking the posture of learning from them. I just think it's really important to kind of step outside your comfort zone before you kind of enter your practice. So it's cool that this is the vocation that we're going to have the rest of our lives, but we're volunteering before we kind of get out there.
I like that we came to Guatemala as volunteers instead of just tourists, because we're living with families, so we get to kind of experience the culture of our family in a different country. It makes the experience so much more valuable, because we're not just people looking at places, we're actually experiencing what it's like to live in Central America, and it's really, really worthwhile, I think my family has done a great job of including me in everything. My sister here had her quinceañera, and it was just a really cool cultural experience, because I know that's a very important, it's like Sweet 16, quinceañera. So that was really cool, and they are very interested, like Sarah was saying, they're just very interested in who we are as people. And at the health post, they've been really great about letting us do things and giving us autonomy and knowing that we have skills that are useful. And because of that, we've really been able to do a lot and experience a lot and learn a lot.
I decided to come down for 3 weeks, and then this year I convinced everyone to come back another time.
And she planned it, so that's why. That's really why I came, because I didn't have to plan.